I was thinking about how research isn't just the icing on the cake for nursing. It's actually necessary.
Absolutely, it's fundamental to advancing the profession.
Exactly. At Sjaellands University Hospital, they've built this whole research culture within nursing.
Yeah,
They went from having no nursing researchers in 2010 to now having 2 professors and 40 researchers.
that's impressive. How did they manage that transformation?
Well, it took a lot of strategic effort. The research chief, Bibi Helga Hazelton, and the deputy nursing director, Suzanne Lundborg-Fries, worked closely to prioritize and integrate research into clinical practice. They believe that research is essential for delivering the best patient care.
And I guess that changes how nurses perceive their roles, right?
Yeah, exactly. It's about seeing research as part of everyday nursing, not just some distant academic exercise.
Right, so they're making research accessible and relevant to all nurses.
Exactly. There's this great anecdote where Bibi was talking to a night nurse who didn't see how research applied to her because she was just a night nurse. And Bibi
Yeah.
pointed out that research on sleep quality directly impacts patient healing, so her role is actually crucial.
That's a perfect example. It shows how every aspect of nursing can benefit from research.
Yes. And by making research practice-oriented, they're enhancing patient outcomes. For instance, they found that poor sleep leads to slower healing and difficulty absorbing information.
Right.
So improving sleep is essential.
But do you think all nurses are on board with this emphasis on research?
Well, there's always some resistance. But they're working to create a culture where all staff see the value in research. It's about integrating it into daily practice.
I suppose leadership support is key in that.
Definitely. Suzanne emphasizes that nurse managers must support and prioritize research.
Yeah.
It's not an optional extra. It's necessary for providing high-quality care.
It's interesting how they highlight that research benefits not just patients, but also nurses' professional development.
Exactly. They're creating attractive career pathways and educational opportunities. It helps
Right.
with staff retention and satisfaction.
Do they have examples of research projects that have made a real difference?
Yes, for instance, they've researched how systematic oral hygiene before surgery can reduce postoperative infections significantly.
Oh,
It can
really?
have the risk of pneumonia after heart surgery.
That's amazing. Such a simple intervention with a huge impact.
Exactly. They've also found that early mobilization and avoiding urinary catheters can prevent infections after hip fractures. It's practical, implementable research.
So it's about applying evidence to directly improve patient care.
Yes, and ensuring that nurses are equipped and empowered to do that. They now have researchers working on topics like sleep, sexuality, end-of-life care, and the link between work environment and patient safety.
That's a broad range. It's impressive they've built that in just over a decade.
Yeah, and they plan to increase the number of nursing professors.
Right.
They see research as integral, not optional.
But how do they fund all this research? Hospitals often have tight budgets.
Initially, departments pooled resources to fund the first PhD student.
Oh, interesting.
It required collaboration and recognizing the collective benefit.
So they share the investment because everyone gains from the outcomes.
Exactly. And now, with leadership support, research is embedded in their strategy. They believe they can't afford not to invest in research.
That's a strong statement. Can't afford not to.
Yeah, and it's true. Without evidence-based practice, patient care suffers. It's essential for safety and quality.
I agree, but sometimes it feels like research is so time-consuming. Do nurses have time for it?
Well, that's where culture and leadership come in.
Right.
They support nurses by providing opportunities and integrating research into workflows.
I wonder if this model could be replicated elsewhere.
I think so. It takes commitment and strategic planning, but the benefits for patient care and staff development are worth it.
Definitely. It's inspiring to see nursing taking such a proactive role in research.
Absolutely. And it's not just about producing research, but fostering a curious and learning environment. That enhances the work environment too.
You know, I was going to say, it probably helps with job satisfaction and retention.
Exactly. Nurses feel valued and see pathways for growth.
But do you think there's a risk of overemphasizing research and neglecting clinical skills?
Well, I think it's about balance. Research should enhance clinical skills, not replace them. And by staying grounded in practice, research remains relevant.
That's reassuring. Integrating both is the way forward.
Definitely. And as Bibi said, we need the very best nurses closest to the patients.
Yeah.
Research helps us be the best we can be.
Well, this has been really enlightening.
Yeah, it's exciting to see where nursing is headed.
Absolutely.